Thank you so much, Dr. Anna, for the nice introduction, and my thanks actually extended to the organizing committee for inviting me today to talk about a vital topic, which is improving a drug user process as an experience from one of the MOH entities, which is the first health cluster in Riyadh. So let's start talking a little bit about what is health cluster and what are actually our vision and mission in the C1. Our vision in cluster 1 is to become the leading healthcare system in the Saudi Arabia by 2025. And our mission actually is very optimistic and promising, which is to partner with the people to help them live healthier, longer, and happier life. Our values in cluster 1 actually has 6 values. The first one is passion, excellence, teamwork, integrity, respect, and accountability. All of these values actually are basically individual-centered, and we are delivering all of these values on the basis of community-centeredness. Let's have some numbers and facts about the C1. We have almost 2 to 2.5 million people residing within the geographical area that the cluster is covering. We are operating 5 big hospitals in the southern and western and part of the central region of Riyadh. One of them is the specialized medical city, and 4 were actually classified as community hospitals. And we are actually operating another 47 primary healthcare entities. The bed capacity that we hold in the C1, almost 10,000 plus bed, nearly 800 of them were designated for the ER and ICU. We have 70 plus major clinical service lines with 60 and 40 outpatient clinics, and we have 80 dialysis beds operating in our area. These are the major hospitals that we hold in the geographical area of C1. Now we will move to the roles and responsibility of drug and pharmaceutical sector at C1. Our mandate is to improve the overall drug use process and to enhance the level of pharmaceutical care provided to patients and other beneficiaries or individuals within our area. Establishments of the state-of-the-art advanced clinical pharmacy services, as we don't have this concept actually fairly well established in our cluster. To resolve the pharmaceutical supply issues and to actually actively work on these things and to increase the medication accessibility by most of the beneficiaries residing within our area. Enhance staff productivity, especially the pharmacists, and making sure that we have some sort of motivations for them, provide them with a training and development, open for them a new opportunity to improve themselves. So this is actually the main mandate of the cluster actually is to not actually to enhance the patient experience only, but also to enhance the internal customers experience, which we mean by internal customers are the healthcare providers. Last but not least, our responsibilities, or the main responsibility actually in the drug sector, is to improve safe and rational use of medications in our area. Our role in transformation, we have a significant role actually to advance patient health by providing a very state-of-the-art or very optimistic pharmaceutical care services We are actually looking for the advancement in the pharmaceutical care. We are developing and disseminating futuristic opportunities for our pharmacists. Our role in transformation as well is to support pharmacists' role as a direct patient care provider. We want actually to transfer pharmacists from being actually bench oriented to be more patient oriented, and this is the role that we are looking for in the future. To create a long-term vision for pharmacy practice models and to ensure massive pharmacist participation as a member of the healthcare team. Now we are actually realizing the importance of the existence of a clinical pharmacy services in most of our hospitals. And now we are witnessing a growing number of clinical pharmacists joining us from different locations. Responsibilities and accountability for patient and population outcomes. This is one of the major actually role as a drug sector is playing to actually improve the patient overall outcomes. These are some of the major milestones that we have done the last year and a half. This activation of medication incident reporting, and we have been forcing this very strongly, and we believe on the impact of medication error reporting in order to outweigh most of the medication-related risks. Establishment of a central P&T committee in order to be another screening step for all the drug addition and deletion and other drug-related policies. Full implementation of WASFATI program or electronic prescription system in 47 PHCs, and now we are working on this to generalize this experience to the whole C1 hospitals. Pharmacy manpower repurposing after applying WASFATI, and we have get most out of the pharmacy resources that have been actually working in the primary healthcare setting, and now we repurpose them to do another job, which actually put into the the transformational KPIs. Opening a medication counseling clinics at different sites, and we actually realized the importance of opening this service and advancement in clinical pharmacy and pharmaceutical care, and our clients, patients, healthcare providers get most out of this service. Last but not least, launching the medication mail delivery service, and this is one of the dreams that I was actually looking for from the beginning of establishment of this cluster, and nowadays it's there, alhamdulillah, and we activate it, and most of the people actually are getting most of the benefits that this service is providing, and establishment of a very strong stewardship program. Let's start talking about the first element, which is activation of central P&T committee. Anybody knows the key roles and responsibilities for all the P&T committee across the world, and you can see that all the roles here are a little bit similar to any of other P&T committees in other healthcare institutions. So we are basically determining the what should be added or deleted from the formulary. We are overseeing the formulary management processes. We reviewed and developed new treatment guidelines and protocols. We are helping other clinical service line leads to set up their treatment guidelines or CPGs into the decision support system, utilizing the data from the electronic medical record to actually inform policymakers about the importance of restricting or putting some policies in certain medications in order to outweigh the risks or to mitigate the effect of certain events, or to if we are looking for let's say financial efficiencies, this will be also helpful. Establishing strategies, programs to improve patient compliance with medications, drug utilization, quality assurance activities, accreditation activities, drug safety and adverse drug reactions reporting, medication error reporting. All of these actually activities may be taken by the P&T committees. This is one of the mechanisms that has been approved in all cluster-wide institutions for adding a new therapeutic item to the formulary. So it should go through a very systematic process in order to get this medication added to the formulary, or it will go through different filters in order to know whether this medication or pharmaceutical item is very important and feasible to be added to the formulary or not. Another mechanism for adding new therapeutic items for PHC's sub-formulary, or what we call it as a WASFATI formulary. We are using actually or utilizing the formulary new addition request form that has been approved by the Therapeutic Deputyship in the Ministry of Health. We are not actually developing a new form, or because we need actually to be consistent with what has been published by the MOH formulary. This is some examples. This is some example actually of the restrictions and prescribing privileges that has been published by the B&T committee concerning the antipsychotic medications. You can see here there is a short list of medications, and you can see the privileges who are able to prescribe certain medications and who are not. And you can see here some PHCs, family physicians, cannot prescribe certain antipsychotics. However, psychiatrists who are actually working on the PHCs can prescribe, let's say, aripiprazole or risperidone and other items with specified strength. For the general hospitals, the list will be wider, and for sure for the specialized hospital. We have been working with the supply chain management department in the cluster actually to manage the overstock of the medications after applying WASFATI. After applying WASFATI, we have dormant stock of medications that has been stuck there for a while, and we design a plan to rotate this stock to other clusters, hospitals, and to get most out of this stock and prescribe it for the patients. Alhamdulillah, we achieved almost 15 million Saudi riyals in 2019 from this activity, and now alhamdulillah we are celebrating this as one of the cost efficiency success story that we achieved at that time. For the sake of drug utilization, we introduced a new drug utilization improvement program. The rationale behind this program is, that the drug use review or drug use evaluation is a key role in helping managing healthcare systems to understand, interpret, evaluate, and improve the prescribing, administration, and the use of medications. The results is very efficient, very important, and it can actually help decision makers to achieve better cost efficiencies, especially in the transformation stage. This is our plan for the utilization project, to set up the baseline costs, and we identify the scope of services that we have, and after that we estimate the quantities that we need, and we will actually obtain the utilization data for the 3 years through the electronic medical records or financial department. Then we need actually to identify optimal use. What are these medications are prescribed for? What are the practices? Some of them need to be actually revised. Some of them need to be modified. Then we measure the actual use. Then we see the difference between them. Then we evaluate it. After we evaluate the situation, we will intervene with some policies or restrictions or other tools that will help us actually mitigate the uninterpreted use of medications. After that, we will evaluate the outcomes of the DUR. Then we will find and we'll report the findings to the higher management and informed policymakers in order to take the right decisions. These are some proposed tools that we will that have been taken into consideration in order to achieve this project. The clinical abuse and misuse. You can see a lot of antibiotics or opioids were overprescribed, and we did some actually very great job in order to reduce or minimize the intensity of prescribing such medications, and we achieve actually a better outcomes, either financial or safety outcomes. Drug disease contraindications. Some of the medications are prescribed for unnecessary diagnoses. All of these practices has been revised, and some of them actually were actually reported to the clinical, to the concerned clinical leads, and they actually met with their colleagues and fixed this problem. Drug dosage modifications and appropriate durations, duplications, all of these things need to be revised and taken care by the pharmacy director in each hospital. Another tool, which is a formulary substitutions. We need actually to go back and see if there is any necessity to keep some of the high cost medications into the formulary, and we substitute them with the generic alternatives. Drug patient precautions like age, gender, pregnancy, activation of very strong antimicrobial stewardship program, expand in providing medication counseling service. This will actually help us to optimize the medication use and to maximize the patient safety and patient outcomes, and to minimize the risks. Activation of medication incident reporting. This is another success story. We have recruited 6 safety officers, and we established a new evaluation team for all the reported medication incidents. This team, actually a multidisciplinary team. We have physicians, we have pharmacists, we have nurses, we have quality coordinators. All of them belong to this team, and we meet regularly every 3 months or 4 months to discuss the incidence of the medication errors and adverse drug reactions in our hospitals. And after that, we came up with a plan to mitigate these, the effect of the medication incidents. The impact actually creates a potential for safer practice, disseminates the concept of just culture. We are actually boosting this practice because this will be it will improve actually the patient safety predictors and will minimize the hazardous effect of the medications. Adaptation of reporting cultures as a professional obligations. Practitioners need to be realized the important impact of the reporting to outweigh hazardous outcomes and to improve communication among healthcare providers. You can see that there is an exponential increase in the medication error reporting since January 2019 until today. And you can see this is the national benchmark, which is 10 medication error per 1,000 item dispensed. And alhamdulillah, from let's say mid 2019, we are in the safe in the safe side. Start actually going beyond this benchmark, and now we are achieving an average of 2,000 reports per month. So you can see the exponential increase in the reporting of medication incidents in general, whether medication errors or adverse drug reactions, and we are reporting an average of 2,000 reports per month right now, overall hospitals. This figure shows the improvement of reporting rate across all the C1 facilities. You can see that the King Saud Medical City reporting 952 per month, followed by Iman General Hospital 636, followed by King Salman, then Imam Abdurrahman Faisal, then Naqwa. This is the reporting rate of medical device. From June 2019, we witnessed a sudden increase in the reporting from 0 to 4,000 in 1 month. We have been actually acknowledged by the Saudi FDA for the increased rate of reporting many times. Alhamdulillah, we receive some recognition from His Excellency, the SFDA President. The key impact area of introducing this service is to improve the quality and the safety, improve the use of medications among concerned patients, improve patient satisfaction, and achieve better patient experience. We have an economic impact of this. It will actually achieve huge cost savings and obtain efficiencies through medication use optimization. We introduced some counseling advanced service. Since September 2019, we have been working on this, and we introduced one clinic in King Salman Hospital, Iman General Hospital, and Imam Abdurrahman Faisal Hospital. Now we have a total of 10 medication counseling clinics. We provide nearly 2,300 or 2,300 counseling sessions. Patients get benefits of these sessions, and they are happy with this service. We actually came up with the fruitful outcomes when providing this service. The counseling sessions has been delivered either physically or virtually. We did actually a case study on May 2020 on the economic impact of counseling services. And we took only 3 services or 3 interventions that has been taken by the pharmacists or in charge pharmacists in order to calculate the cost avoidance that has been achieved by these services. We talk actually medication discontinuation, dose reduction, and duration decrease. And we estimate the interventions that has been taken. The medication discontinuation in May 2020, we have almost 70 interventions, and the cost of each intervention, as per the study of Asiri et al. That has been published in Tropical Journal Pharmaceutical Research. This is one of the reputed journals or high impact journals. And this is one of the studies that has been done in one of the Saudi institutions. And they estimate the cost of interventions, which is medication discontinuation, is 172.5 Saudi riyals. The total number or the total cost avoided out of the medication discontinuation intervention is nearly 11,900. Same thing for the dose reduction. The cost of intervention is 101 riyal, 25 halalas. We made 77 interventions, and this helped us actually avoid paying 7,796 riyals and 25 halalas.
5
Duration,
more minutes.
the same thing. The total cost avoidance were almost 37,000 riyals. WASFATI programs has been activated in all the hospitals. This is the current status of the pharmacies at the PHCs. Most of them were closed, and now we are trying to transform these locations to provide high standard pharmaceutical care services. This is the one of the weekly updates of WASFATI utilization. This report will give us actually more detail on the top 5 prescribed medications, what are the top 5 diagnoses, and detailed information regarding the utilization, the cost of each item, how many patients were served in each location. And you can see here the frequency of e-prescriptions prescribed in each primary healthcare within our C1 or targeted area or our area. Repurposing of primary healthcare, we repurposed almost 164 pharmacists. We repurposed them whether to operate a counseling clinic, participate in research, being a member in drug safety and pharmacovigilance team, oversee pharmaceutical KPIs, working in WASFATI team, being a member in the public health and vaccination, move to work in any C1 hospital pharmacy. Alhamdulillah, we achieved this very successfully, and we repurposed almost 164 pharmacy staff, and we avoided almost 22.5 million riyal by rotating those pharmacists in another vital roles. Launching antimicrobial stewardship program. Alhamdulillah, we are doing a great job activating this program. One of the locations actually where we are mature enough in applying this concept in Al Iman Hospital. We start actually design the program very well. We have an antimicrobial ID clinical pharmacist overseeing the whole process. They start actually editing some of the guidelines in order to limit or mitigate the effect of antimicrobial resistance in the hospital. They came up with the full spectrum, the hospital antibiogram, what are the most hospital resistant microorganisms. And they came up with actions to modify, for example, the community acquired pneumonia guidelines in order to mitigate the effect of antimicrobial resistance. Another success story, which is a mail delivery. Now we delivered almost 23 prescriptions to the patients and their houses. This is part of the virtual non-normal operation, and patients were actually acknowledged this services, and they were happy about it, especially in the pandemic and lockdown period. We managed actually to deliver a great amount of prescriptions to the patients, especially chronic patients.
2 more minutes.
I reached to the end of my presentation, and thank you so much for giving this opportunity to share my experience with everybody. And I hope that everybody get the insights of what has been done in C1. And I believe that everybody actually doing a great job in different locations. but this is actually a very humble, sharing of experience. And I wish you actually a good rest of the night.